And the presentation was actually reducing falls in the inpatient malignant hematology population. We found out that, or discovered that we were having a high incidence of falls, and so we started looking at what was causing the falls and what the situation was, and we discovered that a lot of our patients were falling while going to the bathroom. So we started looking at different things as to what can we put in place to prevent falls while going to the bathroom, and what are certain situations that make patients go to the bathroom more often. So we actually started looking at polypharmacy and different drugs that the patients get. In the hematology population, they're continuously getting fluids to try to prevent tumor lysis syndrome or to keep their volumes up, or it's a fine line between their blood and their fluid balance. So we give them Lasix a lot, and Lasix causes patients to go to the bathroom often and frequently. When you give it, patients can go immediately, and sometimes they jump up to go to the bathroom without thinking about it, and you have an IV pull. Their blood pressures can drop. So we implemented that our patients now have to have the bed alarm on or the chair alarm on anytime a patient gets IV Lasix. We also were looking at situations with falls, and we decided that anytime a patient receives any type of IV Ativan, which can be a hypnotic for the patient, that the bed alarm goes on as well. So that way, if the patient sort of gets into a like sedated state, or they're just not quite there, kind of that we can go ahead and put the bed alarm on and chair alarm on as well, in case they forget to call out for assistance. That way we can try to prevent falls. In our hematology population, if a patient falls, they have multiple issues that affect that. They're pancytopenic, so they have low platelets, makes them thrombocytopenic. If they fall, they can have a cerebral bleed, even death with that. So anything we can do to prevent one accident with a patient or a fall with injury, we're trying to implement that.